A Pune-based patient has passed away after contracting Guillain-Barré Syndrome or GBS, marking the first suspected GBS-related death in Maharashtra. According to reports, the patient who passed away was admitted to the hospital on January 18th with symptoms of cold, cough and troubled breathing. He was placed under the intensive care unit but later moved to a regular ward after showing signs of improvement. However, his condition worsened as he experienced severe breathing difficulties and paralysis in his limbs. The preliminary report indicated that the patient's death was due to GBS only. The Dean of Government Medical College in Solapur has also confirmed this. Now let's understand what happens in GBS. Guillain-Barré syndrome is a condition where the body's immune system mistakenly attacks its own nerves. Normally, nerves carry messages between your brain, spinal cord and the rest of your body. These nerves are like electrical wires covered by a protective layer called myelin, which helps messages travel quickly and smoothly. In GBS, the immune system damages this protective myelin layer or sometimes even the nerves. Without the myelin, signals from the brain slow down or stop entirely, making it hard for muscles to work or for your body to feel sensations properly. The exact reason why this happens isn't fully understood, but GBS often occurs after infections like cold, stomach bug, diarrhea or sometimes vaccination, which might confuse the immune system. Most people recover from GBS with treatment, but it can take weeks to months and in some cases the damage can leave long-term effects. Now, how to spot GBS symptoms? Generally, GBS can cause symptoms like weakness, tingling or even paralysis, first starting in the legs and then spreading upwards. It can also affect reflexes and in severe cases, muscles that control breathing. In some cases, muscles of the mouth also get affected, impacting the eating and talking. Most common and generally the first symptoms are weakness and tingling in the hands and feet. These sensations can quickly spread and may lead to paralysis. Guillain-Barré syndrome is considered as a medical emergency and people with this condition need to be hospitalized in majority of the cases. While the disorder can affect people of all ages, it is more commonly seen in adults, particularly men. Experts estimate the death rate is around 5%, which means 5 out of every 100 people diagnosed with this condition or disease do not survive. Let's understand this from an expert.
Good afternoon. I am Dr. Sanjay Pandey. I am Professor and Head, Department of Neurology and Stroke Medicine at Amrita Hospital, Faridabad, and I am going to discuss regarding Guillain-Barré syndrome, which is currently in news because of large number of cases being reported from Pune area in Maharashtra. Guillain-Barré syndrome is a disease which affects the peripheral nervous system, and the symptoms of this disease is very rapid in onset. Sometimes it may be within hours and sometimes it evolves within 2 to 3 days. Most of the patients complain weakness in legs followed by weakness in hands, and in around 20-30% of patients there is weakness in swallowing in form of difficulty in swallowing, and sometimes there can be breathing problem also. Breathing problem can be sometimes so acute that it can lead to oxygen support or ventilatory support. The disease has a duration of around 4 weeks, and majority of the patients starts improving after 4 weeks time. Sometimes the disease is self-limiting, but sometimes some treatments are required in form of medications or injections which your treating doctor can prescribe, or sometimes patients may require admission also. Talking about this current epidemic, most of these patients of GV syndrome, they have a preceding illness in form of some respiratory infection or some diarrhea-like illness, predominantly by a pathogen known as Campylobacter jejuni. It's not very clear that why so many cases are being reported from one particular area, but looks like there can be some trigger based on some preceding infection, which is very common in this season considering we are transiting from winter to summer, and at this time viral infections are quite common. It's very important to understand that if somebody is suffering from GV syndrome in your family or in your surrounding, then you should not create panic because, as I said earlier, that in large number of patients, disease is self-limiting in nature. Only in a small number of patients, the disease may be fatal or may require advanced therapy or ICU care or even ventilatory care. So we have to be careful, but we should not create panic by spreading wrong information about this disease.